Okay, good afternoon. It's Scott Bruner with KDADS. Could somebody indicate that they can hear me or not? You could. I see a thumbs up from Teresa. Thank you, Teresa. Well, thanks everybody for joining us this afternoon. We've got a little bit of an update from the last webinar that we had about a month ago. A few items that we wanted to catch you up on, and then take questions as well. I do appreciate folks who sent some questions in as well. We got some of them captured in the FAQs and a few more that I printed out that we'll try to walk through as well as we get to the end. But again, if you can type questions into the chat as you have them, that would be great. I've got Hennison Dibwa helping me monitor that the chat as well. I haven't seen, we had some folks from KDHE that were going to join us as well. We'll check on that and see if they've joined us. But in the meantime, let me hopefully you can see the slide deck that we've put together. For today, what we wanted to talk about is kind of updating from our last session on long-term care testing support through the statewide partnership, the status report on testing, give you a new revised count of what we've received from there. Go into a little bit more detail about the process to obtain the Abbott Binax Now antigen tests from KDHE, and a little bit of detail about the reporting process as well, based on some questions that we got the last time. A couple of updates on testing frequency and visitation guidance, which is actually the slides are a little outdated. So we've got more updated information even from today, and then to walk through some of the FAQs as well. So I just, first of all, on testing support. So I think the last time when we did this webinar, we talked about the testing through the statewide partnerships, the regional labs would be available through the middle of June. We've now updated that there's going to be support for testing through the end of December. And that includes both PCR testing and the antigen-based tests through those regional labs. It is important that we keep testing. The CMS requirement, the test is still in place as well. That's the rationale there. But even with vaccines, and we know that in long-term care settings, we've made a lot of progress with vaccination. There's still a lot of people who aren't vaccinated. It's important to track the spread of COVID or any potential variants. So testing is still important, but so there's funding available for that testing through the end of the calendar year. Hennison's letting me know that some people are getting a message that the Zoom is at capacity. I don't know if there's anything I can do about that at this point, given the account that I'm using. So I apologize for that. We'll make sure the slides are available, and we are recording, so we can make that recording available to folks who weren't able to get in. On the status report for testing, as you know, we've been reporting since the beginning of this year, I think, on facilities that are testing through a couple of different ways, either letting us know directly or where we found where they're reporting to labs. And where our last report that was updated from responses on the 8th of March, we've got 215 facilities that we don't know if they're testing or they're not. Almost 499 are testing, and some more that are with a lab but not currently testing. You want to check your status of the report. The link is there on the slide. When you get the slides, you can follow the link to see where that report is. It's also on the KDADS website, and then there's another link for a SurveyMonkey survey to update your status, and then I update that every week. On the bolded type here, the executive order that requires, there's a federal requirement through CMS for testing of staff members. That's a CMS requirement. We've mimicked that with an state executive order. The current executive order does expire next week on the 31st of March. But the update even from today is that the governor is going to announce next week that she's going to extend the executive order on testing in state licensed facilities through the end of May, when the emergency declaration would expire again. So the governor is going to issue that executive order. Given what the new statute that the legislature passed, the legislature can review that and overturn it. So I didn't want to update and say it's an absolutely a requirement, but the governor's intent is to extend that executive order through May. And I know we're getting some questions in. I wanted to get a couple of slides in, and then I'll go back to some of the questions before we run through the FAQ. So that's testing. On the antigen tests, the last time that we had this webinar, we talked about antigen testing. And so KDHE does have a supply of antigen tests, the Abbott Vinex Now cards that they'll distribute to facilities that want to use them. If you're already getting some from Health and Human Services, or but need some more, so you can test residents, test visitors, test other people who are coming into your facilities, and you can't do that in your existing supply, you can request more. So what we captured on this slide is sort of the process for that. You do have to, if you're going to use the antigen tests, we call it 5 simple steps. There are 5. They're not maybe all simple, but there are just 5 steps. You do have to have a CLIA certification, and we've included where the form is to fill out and how to get that to KDHE for their review. Then you want to think about how you're going to use the antigen tests, train folks to do the swab, conduct the test, make sure you can validate that, who you want to test, and do the reporting, those kinds of things. Then you can order the tests from your county emergency manager. These can submit the form with them. And then the KDHE lab will send you the kits based on the number that you request. There's some other information here about actually performing the testing, the instructional videos and things that KDHE's put together. And then there's the reporting element. So if you're doing this testing like any other testing in your facility, those results have to be reported. It can depend a little bit whether you're reporting those through directly to KDHE, through the National Healthcare Safety Network or Lab Exchange or some other system. There is a standard operating procedure that KDHE put together that you can follow to make sure that's happening. But again, the antigen tests are available. There's plenty from what KDHE has indicated available. So that shouldn't be an obstacle to testing where and when you would need to. So we did want to talk a little bit about the reporting process and some of the options. What we've got on the slide here are the kind of 2 paths. One is the Kansas Disease Reporting Portal. This is what goes directly to KDHE, and you can either do this through an individual kind of one at a time entering results, or you can upload based on a spreadsheet, and there's some instructions related to that. The other option is to use a tool called Lab Exchange that then gives you some ability to notify patients or people that you've tested about their results, and look that up. And then the Lab Exchange benefit loads the results directly into EpiTrax, which is the KDHE reporting system. Last time we talked some about Lab Exchange, and the KDHE folks on the call were describing it, so we wanted to give you a little bit more detail about that in this forum. Here's a look at what the Lab Exchange screens look like for your reference, how to do it through a bulk upload in an Excel template. And again, when you get the slides, there's a link there at the bottom of how to follow the demo to see if that's a tool that would be helpful in your facility, or where you work or where you're testing, to make sure we get results reported in a simplified way. The next topic is on visitation. We did want to talk a little bit about where we are with visitation, the guidance. So I think since the last time we met, but the days are running together, CMS had updated their visitation guidance, indicating that indoor visitation should be more allowed, particularly as folks are getting vaccinated across the state, across the country. And KDAD's issued on the 15th similar guidance that would apply that the visitation requirements to state licensed facilities. So they should be the same kind of standards and requirements, and hopefully that's easier to implement. But the basic principles we tried to capture on the slide here, that visitation is strongly encouraged, recognize the challenge not having visitors in facilities have created for residents, for family members, and acknowledging that's an important thing to get started again as it's safe. But that needs to be done in the context of maintaining strong infection control practices, maintaining diligence about testing, and effectively responding to any outbreaks that might happen along the way. It should be person-centered and based on the residents' needs. And that should include compassionate care visits and indoor visits, as well as outdoor and window-based visits, which are all described in the guidance. Compassionate care visits, the revised guidance in only a slight modification of what was already in place, that compassionate care visits should be allowed at all times without restriction as much as possible. If the resident's fully vaccinated, they can also choose to have close contact, including touch with their visitor, while wearing a mask and performing hand hygiene and some of the other infection control practices. So you want to read that closely in the guidance documents about when people can have physical contact as opposed to just being in the same room. There's the definition of who a fully vaccinated person is. It's the 2 weeks after the receipt of their second dose. Or after 2 weeks after they've gotten their single dose vaccine, if they've gotten the Johnson & Johnson vaccine. And then there are some restrictions when outdoor visitation may not be, or indoor visitation may not be allowed, but the principle is it should be allowed at all times for all residents, regardless of whether they've been vaccinated, except for a few circumstances. One is if there are unvaccinated residents in your facility and the facility is in a county whose testing positivity rate is over 10% and less than 70% of the residents have been fully vaccinated. So the important part of this one that is easy to miss, because I've missed it when I initially read it, was this only applies to the resident that's unvaccinated. So if you've got vaccinated people and unvaccinated, the vaccinated people in these same conditions could continue to have visitors, but residents that aren't vaccinated yet could be more limited. You can't have visitation with residents who've got a confirmed infection until they can discontinue their transmission-based precautions. And then any residents that are in quarantine until they've met the criteria for release from quarantine could have limited visitation. But so that's a pretty small number of limitations as it goes. We did get a lot of questions about kind of details and particular examples. So we'll try to walk through some of those as well as we go. Before maybe I jump into the FAQs, I want to pause for just a second and see if we've gotten any of our folks from KDHE on the call. I've got to scroll through the list and see. Well, they'll jump
Apologies,
in.
Scott. I was muted. So Jonan and Courtney both got on post capacity, so they're not able to join the call. And any questions that we can't, we'll just take back to them.
Okay, sounds good. Thank you. Before I jump into the FAQs, then there's a question in the chat. Since we can no longer require testing for visitors, how do we encourage them to be tested even if they are vaccinated? The guidance doesn't say you can that you ever could have required testing for visitors. You need to accommodate their interest. You can make it available. I think it's probably part of all of the communication about why we need to continue testing even when vaccines available, just to know where the virus is and how it's moving through the the population. So it might be a modification in your policy or the test or the visitation protocols you've got in place to make it available. But again, you can still require social distancing, mask wearing, hand hygiene, all those kinds of things, good infection control practices. So there's probably a balance there. But it's kind of bringing everybody along with the need for testing as well. What if a resident cannot be vaccinated due to health issues, but family has been vaccinated? Can they have visitation like those residents that have been vaccinated? Yes, they, except for those few restrictions that I just talked about, the vaccination status of the resident doesn't matter. Again, as long as you've got some of the other infection control practices in place. So I think that's covered in the guidance itself. Since the vaccine is only good for 90 days, do you anticipate having to restrict visitation again in the future until the tested effectiveness timeframe for the vaccine? That's a good question. I think the restrictions on visitation coming from CMS would depend on conditions and how things move through. If there's another outbreak or a variant, that might change. So again, we'll follow CMS's guidance on that. I don't know that there's a hard and fast 90-day clock that's ticking, but again, it'll depend on the conditions. Does a resident have to wear a mask with visits? Most will not. Also, who determines a compassionate caregiver? Because almost anyone can qualify. Well, on the compassionate caregiver part in that question, the CMS guidance and our guidance is pretty clear. There is a broad definition of who can participate in a compassionate care visit. It largely depends on who the resident wants to have participate in that compassionate care visit and provide that level of care visitation. So again, it's a very broad definition, but I'd look at the guidance and read through that. Does the resident have to wear a mask with a visit? And the CMS guidance is pretty clear, and even some clarifications they've issued recently that you need to do your best to maintain, have good infection control practices in place for visitation, including social distancing, mask wearing, hand hygiene, those kinds of things. So, I mean that's probably the implementation element that's going to be a challenge. But what the standard CMS has put in place is that you need to do your best to maintain good infection control and social distancing. I'll find here in just a second what CMS has said about that. But again, you've got to do your understanding that people may not want to wear masks, but that's part of the maintaining infection control. Does indoor visitation need to be in a controlled room, or are family members allowed to go into their apartments? The guidance does say if a room is shared, you shouldn't let people into individual rooms there. But no, I saw Lacey Hunter was on the call as well. If she has some thoughts about that one, I'd ask her to chime in. Communal dining, there is some description about communal dining. The CMS guidance talks about maintaining social distancing, but you could have communal dining, but there's got to be social distancing. So we got a clarification from CMS on that particular item. And here's what CMS said: the communal activities and dining section of the updated CMS visitation guidance notes that residents may eat in the same room with social distancing, a limited number of people at tables and spaced by at least 6 feet. Additionally, per CDC's guidance preparing for COVID-19 in nursing homes, aggressive social distancing measures remain unchanged. Permitting dining with residents sitting less than 6 feet apart, even with plexiglass in place, would not meet the intent of the CMS and CDC guidance. So I don't think that if the question is about full communal dining without restriction, I think CMS would say you've still got to maintain social distance. Is there still a suggested time limit per visit with family? Actually, CMS said the same, or a similar kind of thing about time limits. In their clarifications, they said facilities may need to limit the number of visitors at one time as well as the total number of visits, but they should not be overly restrictive. So it's a soft standard, but what they said was in accordance with section 483.10 F4, the resident has the right to receive visitors of his or her choosing at the times of his or her choosing. There are no regulations that restrict visitation to only certain hours of the day or with time limits. Expect facilities to make concerted efforts to allow as much visitation as is able to accommodate while adhering to the core principles of infection prevention. Can a resident eat with their visitors if distanced? I don't believe we had an issue with eating that we did put in our guidance, in the state guidance, about bringing food in, but social distance would be important. Can you talk about outdoor visiting and residents eating distanced or not? Outdoor visiting is described in the guidance, both guidance documents. Does talk about social distance there. So I guess I don't know how to answer that question. Will they expand the age for at least outdoor visits to include children under the age of 12? I'm gonna have to reread the guidance or get some other perspective on the age limits, because the age limits were based on whether they'd comply with the facility guidelines for testing and for visitation and social distancing. So let me read through that one so I don't go too far off course. There's still some questions coming in, but I did want to go through the FAQs here because we did spend some time updating these documents. So I'll try to remember where my place was on the chat and come back to it. We broke these into some sections about testing. The first couple of pages here are about the antigen tests and some of the description of how to get the test requirements or the Abbott Binax Now tests, how many you can receive. I don't think there were any updates on this page. Oops, went the wrong way, sorry. Who to contact. In the CLIA application, you can see that on the slide as well. On reporting for labs, how do we report using the rapid antigen tests? Again, you can use the disease reporting portal or lab exchange. The second question on this slide, we did modify from the last version to be clearer. If we are reporting antigen tests to the National Healthcare Safety Network, do we also have to report to KDHE? And so if you're reporting results through NHSN and that meets your reporting requirement, you don't have to do something separate for KDHE. And you're not required to report antigen test each day to NHSN. And vice versa, if you're reporting to KDHE, then that meets the requirement, but you still have to report test results and positive cases through NHSN. That requirement still overlaps with the CMS requirement, and we listed or put the links in the question with the CMS guidance or CMS memo and the CDC guidance. And then you can report through Lab Exchange and some of the information that we had there. So we didn't want to give you the impression that there was no requirement to report to NHSN. If you're a facility that has to do that for CMS requirements, you still need to, but the testing of antigen results can be a little bit varied. I think those were all the same answers there. A couple more comments about Lab Exchange as well and how that clarifies. So again, we'll send these out, but just to give you a flavor of what's in the FAQs. Visitation, we stop social distancing? Again, no, the CMS direction is that you want to maintain social distancing even if you've got a vaccine in place. How long will the executive order be in place to test? Again, it does run through the end of March. The governor is going to reissue that executive order no later than April 1st to go through the end of March, or I'm sorry, end of May. But again, that could be reviewed by the legislature. So that's going to go out through the end of May. I think we talked about the red category before. If fully vaccinated individuals outside of the 3 months after they've been vaccinated, do they go back to the prior guidance? Again, we're not quite sure. We're waiting for CDC to issue what they might say about somebody who's been vaccinated and now they're outside the immunity window. So ask for a little more patience as we wait for that CDC direction. We did try to put more of the visitation guidance here in the questions about visitation times and limits on hours of visitation. Again, the CDC or CMS guidance does talk about it when you're setting visitation hours. Think about times when the residents could be at high risk of contracting COVID, vaccination status, testing policy. You want to allow as much visitation as possible. Again, that's what I read you from CMS. And then we added the visitation guidance in here as well for post-vaccine. Couple of comments about vaccine, and maybe I'll go quickly through these and back to the chat. What's the plan for continued vaccination? The direction that we've been given from KDHE is that vaccine, there's going to be more vaccine partners, so you should work with your health departments and other vaccination partners along the way. So if you've got somebody who supplies your flu vaccine, they ought to be getting some supply of vaccine as well, but to vaccinate new residents, new staff, people like that. If that is a problem or you're having an obstacle, we'd love to know about it. You can send us an email through the KDAD's reopening mailbox or me directly, and we'll get those through KDHE so we can make sure there isn't an obstacle. I think this question about the boost dose was the same as the last time. You have to quarantine if you've been exposed to COVID-19 after you're fully vaccinated. We did get several questions about quarantine status post-vaccination. The guidance from CDC that CMS has adopted talks about the quarantine of people for staff and others. It doesn't specifically apply to residents. So if you've been vaccinated and you've had a close exposure, you're an employee, you're a staff member in a long-term care facility, you don't need to quarantine necessarily. But that hasn't applied to visitors yet. We know that there are some county health departments that are issuing some guidance. We've seen some from Johnson County that would indicate that residents wouldn't have to be quarantined, but we're still waiting for an official description of that from either CDC or CMS before we issue it in a broader way. Cost of the vaccine, I think those were all the same from the last time. How long will the protection last for the flu vaccine? Again, it's in the 90 days to 180 days. Not hoarding vaccine. These were largely the same as the last time. We have gotten some questions from this first question about if you've started with one type of vaccine and then the county is shifted to another type and you still need the boost dose. The direction from KDHE has been to reach out to the pharmacy that might have the kind of vaccine that you need. If that's an obstacle, then you need to reach out to your health department or the COVID-19 email address that's on here, so they can work through that as well. Those were all the other. Those are the other ones that were largely the same as from the last time. So I'm going to turn back to the chat for a minute and see what questions there are there.
Scott, I can run through a few of the questions that came up that we hadn't answered yet.
Okay.
And I'll just start bottom up. So the first, Evan had asked, or he had said that in yesterday's webinar, well, Evan in yesterday's webinar said that there's no reason to test visitors. And so apparently getting mixed messages. This is something we can take back to KDHE or just regroup on, but I'm not sure if you have an answer here, if they have to test visitors or if they should test visitors.
Yeah, I think we want to check with what direction we're getting from CMS as well, just to make sure we're consistent. I don't know that I've seen that, but others may have. If we had somebody else who wanted to chime in on that, then we can clarify.
Got it. Before I go on to the next slide, just put up a question. Do visitors include compassionate caregivers when it comes to testing? So would compassionate caregivers be in the same bucket as visitors, or would they be something else?
The CMS guidance about compassionate care visits is intended to be more or less restricted on people who are coming in to do a compassionate care visit. So that needs to be more allowed and promoted. So I mean, they are visitors. They're coming in from outside, but whether you could restrict somebody completely if they didn't want to be tested, we'd probably need to clarify that with CMS.
Got it. So a couple of these questions are the same. I'll ask this question and then just the general question around it. So there are residents that want to go to church on Sundays, and so if they come back in, do they have to quarantine upon return? And then that's just a general question that I know we were talking about earlier this week. If somebody leaves a facility for a short period of time, do they have to quarantine when they come back?
The operative part of that we're waiting for CDC to clarify is if somebody leaves for a short amount of time and they're not exposed, they don't have a known exposure. So if you look at the guidance that CMS issued around Thanksgiving and Christmas and kind of the holidays at the end of the year, they indicated there that if somebody was outside of the facility for less than 24 hours, they wouldn't necessarily need to be quarantined if they didn't have an exposure. So I think that would be the policy you could follow. You could make that your facility's policy. We are, again, I wish I had a better answer, a more definitive answer than that, but we're not. We're waiting for CDC to come out with a consistent point of view on quarantine after vaccination when you leave. But when I read through that holiday guidance, and we'll put that in the FAQs when we send this out, it says, to consider how long they were gone and if they had any potential exposure and the ability to track that as you're making decisions about quarantine. But I know what you all want is the definitive answer, and we don't have that. Don't have that today, but the indication would be it would be allowable. Lacey, did you have a thought about that, or saw you came back on?
I agree. I think that we're waiting on that updated guidance, but I do believe that we have indication that is the direction that they will be headed. We just have not seen that in writing at this point.
So next question is, families are calling ahead of time to schedule visits. And so do assisted living facilities need to require appointments or not need to require appointments for visitation?
I mean, requiring appointments, again, what CMS said was you shouldn't be overly restrictive, but they do acknowledge that you may want to have a limit on how many residents or how many visitors were in the building at one time, or the total number of visitors in the facility at one time. So I guess that's the balance of can you maintain a reasonable number of people in the building at once without the requirement for appointments. The CMS kind of says be permissive to promote visitation, but also make sure you're maintaining good infection control. It's kind of both and, which I know is not, again, the answer that you all want, but it's much more about what conditions you can maintain than a hard and fast standard, even from CMS.
Next question that came in is, if all residents within the facility have been vaccinated, do you still have to maintain the 6 feet social distancing?
We can keep talking about that, to consider what that would look like. But the CMS, when we've asked other questions and CMS provides answers, they come back to maintaining social distance is one of the key ways to prevent spread and infection from between people who are around each other. So I think that's the goal, is to maintain social distancing as much as possible.
Can I add to that one?
Yeah, go ahead.
I think the other thing that they kind of try to propose as the idea is being vaccinated is just one of the tools to help prevent the spread of COVID-19. And you can utilize the other tools if you want to ensure the uptake versus the spread.
Yeah, good point.
Got it. Let me see. This is a similar question. If residents go out can residents go out with their visitors to eat, and do they need to be quarantined upon return? So another similar question too. If they leave under 24 hours, do they need to quarantine upon return? And that one, we're still waiting on CMS guidances there. And so we can bring back a more definitive answer.
Yep.
And then, are vendors being allowed into LTC facilities? And I guess this would then hinge on whether vendors are considered visitors or staff.
Yeah, I think the CMS, we use the word visitor in the CMS and the KDAD's guidance, but that's all in the context of people who are not staff, not residents of the facility. So I do think you can have fewer restrictions on outside vendors that need to come into the building, still screen, still good infection control, social distancing, all those kinds of things. But you don't have to be as restrictive as the original CMS requirement was for visitors and outside vendors and the other people they identified in that earlier QSO.
Can I you?
Yeah.
I would still, for those facilities who have testing requirements, make sure that you're looking at that QSO memo for the testing requirement on what they consider a healthcare personnel, and that you're still meeting the testing requirements for those personnel.
Yeah, good point.
I'll have to switch. Let me know if the static is still this bad, and apologies there. So we have seen testing of visitors really drop since I guess that's more just stages. Let me run through the remaining of the chat, and I think there were more questions that came in. factor. And so if residents or the people that represent them vote to fully open the facility without restrictions, do they have the right to do so?
So I think, or the rep, do they have the right to do so? Well, so if you participate in the federal program or you're licensed by KDADS, Medicare certified, or you're licensed by KDADS, the requirements are still in place for some limits on visitation in those kind of limited circumstances. So do they have the right to do so? They can do whatever they want, but we'll enforce the federal requirements and state requirements as they're written. Now that's before these clarifications were issued, in March. That would have meant you shouldn't allow visitation except for compassionate care. I mean, there were more restrictions. So it's in the context of many of those limitations being removed already. So maybe if the question was about, if the residents vote that nobody has to wear a mask inside their building, and then we would look at it in terms of, is the facility maintaining good infection control practices? We might not agree that's the best approach for good infection control, as an example. So yeah, I mean, of course, people have the right to do what they want, but our role is to regulate facilities based on the federal and state requirements that aren't that you can't waive your waive is probably not the right word, but you can't choose to not follow the federal rules. I don't know if that's any clearer, but
and Scott, these are all of the questions from the chat that I'm tracking on my end, and
okay.
And I can compile all of these, and we can take them back as well to KDHE, KDADS, and get more definitive answers for where we can, and add them to the FAQs. But I'll hand it back to you.
There were a few that we got by email in advance. Some of the questions about appointments and about going directly into rooms, into a resident's room. And again, with that question, if a resident shares a room with somebody, then there's the CMS guidance is pretty clear that you wouldn't want to put the other resident at risk and find a common area instead. There's a question that we got again by email about, is full PPE required for visitation of residents not in quarantine? I guess if the question is full PPE, it's if you wanted to have people wearing face masks to visit, that the CMS does talk about face masks, social distancing, hand washing, those kinds of things as as a best practice. Questions about limits on the number of visitors at one time, but maybe the one thing we didn't answer that was in this question was about, what about two people that don't live in the same household? Did they have to social distance from each other by 6 feet and the resident? So I think the scenario was you've got a resident with visitors from two different households. So yes, social distancing would be appropriate in that environment, and that fits with all the other guidance and direction as well.
Can I add into that one a little bit?
Yeah, go ahead. I'm trying to read ahead too.
Okay, so when talking about in-room visitation versus a visitation area, our guidance and the CMS guidance, I think both lend to the idea that you should restrict the movement of visitors within your building, but that doesn't mean that you can't have them go to a resident's room. What that means is that we would like for you to take the most direct path to that resident's room or to the visiting area, but neither one of the guidances restricts the ability to have visitation within the room. If there are roommates, you should try to restrict that visitation. But if the roommates cannot leave the room for health reasons, you should not restrict visitation due to the inability to leave the room. That's all.
I think maybe the only other question that we got by email, I mean, there's some kind of variations on themes. Well, two. So we did get a question by email about, is there a time frame on how long will be required to test staff? And again, that's a CMS requirement. We're watching to see if they're going to move from that at some point as vaccine becomes more available. But at this point, that's still the requirement. And for state facilities, again, the governor is going to re-release or release a new executive order to extend that for state licensed facilities to test staff based on county positivity rates through the end of May. That's when the executive or the emergency declaration ends. And then the other question that we got by email, and we haven't talked about it in other contexts, was for temporary aid licensure. And the question was kind of general about where we are with that, but just to provide an update here. So at the beginning of the pandemic, we issued an executive order that allowed a new category of folks that could be temporary aides and do some direct patient resident care if they passed an 8-hour course and were working in your facilities. That's been extended now a couple of times. That also expires at the end of March. On March 31st, essentially, those temporary aides would no longer be able to do the work they're doing as temporary aides. They could still be employed. They could still work in your facilities, but they couldn't necessarily have the same role. That executive order is going to be extended as well, or at least the governor is going to issue an executive order to extend that next week for April and through May, through the end of the emergency declaration. So that gets everybody another 60 days or so to get those temporary aides into CNA courses, if that's what they want to do, to continue providing direct patient care, to find a course, get them enrolled, get them through part 1 and the skills checklist, and then they could apply their worked hours towards their trainee too. So a little bit of a reprieve there, but as far as we know, that's not going to be extended past May 28th of this year. So the clock is ticking, but we've got good connections with the CNA training programs and schools and community colleges, technical schools that want to meet as much of the need for training students as possible. We also need to encourage them to find clinical locations so the training can happen and we can move CNA students through. So we'll keep working on that, and we've got another couple of months, but that time will pass quickly. So we don't want to lose any ground. And I don't think I've seen any other questions come through the chat. So our plan is to take these slides and update them for the questions that we got today to make sure we follow up on the ones we need to, so that we can get a good answer for you, post those, and get them emailed out as well. Yeah, by the middle of next week is our target. Are there any last questions? We'll keep working on the format of these webinars. I think it is a good environment to share new information and to get it out. KDHE has been doing these since the beginning of the pandemic, and they've got a really good routine. I apologize for being a little clunky and not having it quite as smooth as if you listen to the KDHE calls, but we'll keep working on it and make sure we've got the right people on too to answer questions. There's a question about the slides being available online. We will post them to the KDAD's website, our COVID page as well. Resident who's not vaccinated could have a touch visit as long as the family member has been vaccinated.
The CMS guidance does not speak to that. They speak to the reverse of that. They speak to a fully vaccinated resident can choose to do that, but they do not cover the reverse of that in the guidance as allowable.
That's what I was trying to read that as well. And then the last question, then we'll let you go for the afternoon to clarify: is the extended waiver for temporary aids in May, or are we still waiting? It'll well, the executive order is going to be issued next week to go through April and May. And then as long as the legislature doesn't reject it, that's we'll have temporary aids would be able to continue through May 28th. Maybe then the last question was allowing self-temperature taking for employees. Can nursing homes do this, or do you have to ensure someone else has screened the employee? CMS talked about that in some additional direction that we got.
I don't believe the intention is that CMS intends for anyone to have to actively screen. They do intend for facilities to have
documentation
and something in place for people who screen positive. Policy procedure in place for those who do screen positive. So in this instance, if you're not having someone self-monitor, if you are doing self-monitoring, how are you going to catch everyone that screens positive and ensure that they follow the steps as they should for to follow your infection control policy and procedure?
And then maybe this is the last one. We're anticipating that families will want to take residents out to higher risk activities, such as groups where everyone is wearing masks, larger size groups. Not a known exposure or inclination is to want to quarantine them. What are your thoughts? I think it's a great question. It would be good to get more direction from the CDC about that scenario of larger groups. And again, I think we're relying a lot on the definition of what a known exposure is. The larger the group is that people are around, the harder it is to track that, as you all are well aware. So I think there would be certainly more risk involved in that. And we'd want to think through that. Again, if you've read the CDC guidance about visiting with vaccinated people, they talk about one household, one household to one person, as opposed to multiple households, and that being permissible. So again, the question I appreciate being what are our thoughts? So our thoughts are it is risky, but I don't think we've got a clear enough direction about quarantine practice for vaccinated residents to be able to weigh in definitely. But I do think it's understand the inclination with the other things you have to balance. That's certainly worth considering maintaining quarantine or some kind of testing protocol or something like that on the back end of that visit to make sure things are still safe and everybody's well. So with that, I appreciate everybody's time. And I'm sure it's been painful to have to listen to me for an hour, and I didn't even introduce myself because I just jumped right in. I'm sorry. Scott Bruner with KDADS. I'm the Deputy Secretary for Hospitals and Facilities. So jumped way ahead of myself. So again, thanks for your time. We'll get the recording and the slides, updated slides posted middle of next week. And again, if you have other questions, feel free to send them along, and we'll keep working forward. Thanks for all the work that you do to keep our citizens safe and well. And we'll talk again soon.